get osteoarthritis, in a nutshell, joints are designed to move a certain way, and some joints like the shoulder and the hip joint move in 3 directions. They're called ball and socket joints. So the ball moves in a cup and it can move freely in any direction. Whereas other joints, such as the knee and the finger joint, they are called hinge joints and they move forward and back. That's it. And they don't tolerate rotation too well. The only problem comes when there's a hinge joint like the knee that's stuck between 2 ball and socket joints, such as the hip and the ankle complex. I mention the ankle complex as there's 3 joints that allow the ankle to move in 3 dimensions: front, back, side, and rotation. But when there's excessive movement at the rotational joints, such as the hip and the ankle, and then the hinge joint, which doesn't tolerate rotation very well, gets twisted and torqued in the middle. And this twisting and torque over time applies wear and tear to the joint, and as a result, degenerative changes in the form of osteoarthropathy occurs. Now, you're wondering what osteoarthropathy is. Well, it's the degenerative change to the joint, but when you get inflammation of this condition, you get the itis tacked onto the end, and so you get osteoarthritis. A clear understanding of the objectives and outcomes behind a patient's treatment is one of the most important things to determine at the outset of every treatment plan. And every person's arthritis is mechanically different, so by having your joints evaluated by experts in the rehabilitation field can not only determine what your arthritis looks like and how advanced it is and what treatment options exist for you, but also what factors contributed to and continue to contribute to your arthritic progression. The more that we can control those variables and factors that are leading to your arthritis, the more we can slow the progression of your arthritis. Diagnosing osteoarthropathy and arthritis can be quite confusing. And one thing that I'm going to touch on in this article is the relationship between what you see on an x-ray or an imaging test and what actually is the source of the pain. Most x-rays, which is usually a person's first step, is done in what we would call a non-weight-bearing position. This means when you go to the x-ray department, you're lying on a table and the x-ray gets taken. Unfortunately, most of us don't actually spend most of our day in a lying down position. And it doesn't provide an accurate picture of what actually exists when we're standing upright and walking around, which is a weight-bearing position. So in order to truly look at the severity of the osteoarthritis, x-rays need to be done in a weight-bearing position of the knees and hips and ankles, and additionally, along with the traditional views that would be done on a table. One of the things that is often found on an imaging test, such as an MRI, are tears to the cartilage, which are also known as the meniscus in the knee, but also labrum that you find in the shoulder and in the hip. Once these are found on imaging, it often allows patients to go, finally, that's the reason for my pain. When in fact, for most patients, as we age, we develop what are called degenerative tears to the cartilage in our joints. This is caused by the combination of high loads going through the joint at abnormal patterns and poorly controlled speeds. Imagine having a car that's going down a bumpy road, which is not uncommon in Muskoka. A brand new car will float along with great shocks, and they'll tolerate the bumps. This is what it's like having joints that are balanced and strong enough to manage the loads that are being applied to it. But over time, driving too fast and making hard turns cause the shocks to wear down, and more of the bumps are felt by the car and the passengers inside the car. Now the wear and tear is on the body and the chassis of the car, and over time this breaks down and you need a new car. So more of the forces get transmitted to the bones and get changes to the bones. And the bones aren't designed, and the joints aren't designed in ways to get loaded in ways that are excessive and too fast. And one of the best and most powerful treatment plans for pain is actually weight loss and correction of the mechanical issues that are leading to the arthritic changes in your joint. So while pills and injections, those kinds of things can certainly help, the one thing that will truly help with your arthritis is actually getting to the root of the problem, figuring out what kind of thing got you to this point, but then also correcting them so it slows down how fast the arthritis is going to progress. And we can help you with that. Let us reactivate you.